Have you ever been told that you're bendy, double jointed, or as a child that you just had growing pains? Yet years later you're still dealing with pain, fatigue, joints that clunk or give way for no clear reason. If that sounds familiar, it could be a sign of joint hypermobility, or one of the related conditions known as Hypermobile Spectrum Disorder, HSD, or Hypermobile Ehlers-Danlos Syndrome, or hEDS, which I'll talk about more today. I'm Nic Brown, I'm a pain specialist physiotherapist, and in this short video, we'll unpack what hypermobility really means. Remember that this video is for general information only and is not intended as individual medical advice. So hypermobility simply means that your joints can move beyond the normal range, and that's due to differences in connective tissue. And this is the body's sort of internal web. It connects, it supports, and it integrates everything from our muscles and tendons and organs and fascia, and it gives the body its structure and flexibility. Now, for some people, that extra flexibility doesn't cause any problems. And in fact, it can be an advantage in things like dance or gymnastics or yoga. But for others, it can lead to ongoing pain, fatigue, joints that feel unstable, along with a range of other symptoms. The surrounding muscles have to work harder to keep things more stable, which adds to tension and fatigue, while people with hypermobility often feel achy or drained without necessarily having done much. So hypermobility exists on a spectrum. So at one end, there are people who are just naturally more flexible, but they have no associated symptoms. And at the other are those whose flexibility causes significant pain and associated symptoms and daily challenges. So coming back to hEDS, this is a heritable connective tissue disorder, and it affects not only the joints, but other parts of the body too. People with hEDS usually have generalised joint hypermobility, along with a range of other features like the soft, stretchy skin. Often they bruise easily. And they have symptoms like often palpitations or dizziness when standing. It could be linked to a condition called POTS, digestive issues such as bloating, reflux or IBS type symptoms, bladder urgency, pelvic discomfort, poor temperature regulation, headaches, migraines, jaw tension, often poor sleep or waking unrefreshed. And some also have a condition called MCAS, where they have an excessive and recurrent immune activation and not always with a clear trigger. And often the pattern of symptoms can feel unpredictable. There are good days and bad days, and often without an obvious reason. And it can have a real impact on daily life. It can also feel really overwhelming when each symptom gets treated very separately instead of being recognised as part of one condition. There are rarer types of Ehlers-Danlos syndrome, but hEDS is by far the most common, and it's the one that I'm talking about today and the one that I see in clinic. If you don't meet the full criteria that's laid out for hEDS, but experience similar symptoms, then you may be diagnosed with HSD. At the moment, there's no genetic test for hEDS or HSD. Diagnosis relies on a detailed clinical history, there are clinical guidelines, and it's by examination by someone who's familiar with these conditions. Unfortunately for many people, getting that diagnosis takes years. They're often passed between different services, told conflicting things, feel misunderstood, frustrated, and made to feel like no one's quite listening. Due to this, and the impact of living with an ongoing condition, there's commonly an emotional impact too, and low mood and anxiety are often reported. It's important to remember that your symptoms are real, you're not alone, and they make sense once you understand how connective tissue affects a range of body systems. That understanding is the starting point for meaningful change. So with the right combination of understanding, education, support and rehabilitation, it's absolutely possible to build stability, strength, confidence and trust in your body again. So approaches that focus on body awareness, pacing, stability and lifestyle can make a huge difference. So I want to credit the EDS Society for supporting my ongoing learning so I can better support people that I work with in clinic. And they're a great resource for people living with hEDS and HSD too. In the next video, we'll talk about the practical ways to help with these conditions and where to start. So stay tuned for next time. Thank you so much for watching today, and I'll see you in the next video. Remember to like, subscribe and to share with anyone who you think needs to hear this today. Bye for now.